KEA Tutorials presents a pediatric condition, respiratory distress syndrome. Respiratory distress syndrome, otherwise called hyaline membrane disease, or surfactant deficiency, is a common breathing disorder that affects newborns. It usually occurs in babies born before 28 weeks gestation, because of the immaturity of their lungs. Specialized cells in the lungs called the pneumocytes, most precisely type II, are responsible for the production of surfactant, a mixture of phospholipids and lipoproteins. Surfactant acts on the surface tension of water film in the alveoli by reducing it, thereby preventing the alveoli from collapsing. It also reduces the work necessary to inflate them, and by so doing eases breathing. With surfactant deficiency, there's increased work of breathing and alveolar collapse, leading to decreased lung compliance. Risk factors include preterm delivery. This is delivering a baby before term, which is 28 weeks gestation. Diabetes, especially on the maternal side. An abnormal lung development, cause that will impair the production of surfactant. The following video obtained from Nucleus Media best describes the symptoms of this condition.
Infant distress means your baby is having difficulties. Knowing what to look for will help you know if your baby is in distress. Your baby may have breathing problems, such as retractions, grunting, and apnea. Retractions are unusual breathing movements. With each breath, your baby's chest muscles pull in the skin around the bones. Grunting is a noisy breathing sound. Your baby may grunt to keep air in the lungs. Grunting may sound like snoring or singing. Apnea is a condition in which your baby pauses breathing for 15 to 20 seconds. Then continues breathing. You may notice changes in your baby's skin. Two common findings are conditions known as cyanosis and jaundice. Cyanosis is a blue skin color. You can usually see it around your baby's lips, chest, and stomach. This blue color means that the oxygen level in the blood may be too low. Cyanosis may mean there is a problem with the baby's lungs or heart. Jaundice is an overall yellow skin color. It happens when a substance called bilirubin builds up in the blood. Most babies have some jaundice that appears more than 24 hours after birth. If left untreated, severe or long-lasting jaundice may cause brain damage. It's important to check your baby for these signs of distress.
Surfactant deficiency is common in premature newborns. Thus, doctors recognize it and begin treatment as soon as the baby's born. But they do extra tests to confirm and rule out other conditions that could cause breathing problems. Tests like X-ray, to detect lung abnormalities like collapsed lung. Blood tests, to determine the availability of oxygen in blood. And also some infections that can cause breathing problems. And lastly, echocardiography, to rule out heart defects that can lead to breathing problems. The first treatment option is surfactant replacement therapy. This is delivering directly to the baby's lungs surfactant, to ease breathing through an endotracheal tube. Also supporting the baby breathe is necessary, oxygen therapy. All these to prevent hypoxia. Most recently, babies receive support through CPAP, which stands for nasal continuous positive airway pressure. In the neonatal intensive care unit, treatment turns around warming, nutrition and protection. It involves fluid intake monitoring, to make sure fluid doesn't build up in the lungs. Oxygen monitoring, to make sure the baby has enough oxygen. Nutrition, to prevent malnutrition and ensure baby's growth. Vital signs monitoring, to make sure baby's doing okay. Using an incubator, to keep our baby warm and reduce the risk of hypothermia. Now let's have a view of the nursing management of this condition. To manage this as a nurse, we'll need to identify the cause of the respiratory distress syndrome to guide our actions. Then we'll need to administer oxygen to the patient, this to provide the body with enough oxygen and prevent hypoxia. Then, positioning the child in high Fowlers, to promote lung expansion and restricting fluid to prevent pulmonary edema. Provide respiratory treatment as prescribed by the doctor, so as to support the respiratory system perform its functions. Then intubating the child and connecting to a ventilator to provide the lungs with enough oxygen to supply the system. Administer diuretics, to tackle the pulmonary edema. Anticoagulants, to prevent the formation of clots, for these can settle in the lungs and cause problems. And lastly, corticosteroids, to boost lung development and prevent inflammation of the lung tissue. Let's dive into the preventive measures to this condition. To prevent this condition, eating healthy is necessary as an aspiring mother, so as to ensure the fetus grows and develops well. Managing present conditions. Avoiding smoking, for this can lead to delays in fetal development, and malformations in this process. Attending ANC, for every problem noticed will be cared for. And lastly, corticosteroids, for they speed up the development of the lungs, the brain, and the kidneys and restore surfactant production. It's usually given when a woman is suspected to give birth too early. Thanks for watching. Don't forget to subscribe and smash the notification icon so that YouTube keeps you updated of our activities. See you in another video.